So if you're a soccer player having knee pain, it could be from multiple issues. You might be having meniscus irritation, so that is the bushing, the cartilage that sits between your two bones in your knee. You can also have any number of things from muscle tension to a ligament sprain, sometimes the patellar tendon, so the kneecap as it sits over the femur, as it slides in there, sometimes that can get irritated or have an asymmetrical wear on it, which then creates some irritation either on the inside or the outside. So any number of things, additional things like iliotibial band syndrome or runner's knee, all of that is very common in soccer just because of the total volume of running. So when you come in, we take a thorough history to figure out exactly what problem it sounds like you're having, so that then we can focus our exam more specifically on your needs. The first part of our assessment would be a range of motion, what we call a top tier. So we would just start at the top and work ourselves down. So I'll take you through that right now. So Tate, I'm going to have you tuck your chin as far as you can. So we're checking to see how smooth his curve is and see if his chin can touch his chest here. Now bring your head as far back as you can. So we're trying to see how level he can get his head there. Back to neutral. Look right as far as you can. Good. And left. Wonderful. Now face this way, please. And get this hand and touch right in through there. Perfect. And the other side, please. Good. And then now this hand touching right there. Perfect. And now the opposite side. So we're just getting a global view. So this side's a little bit more difficult. Getting a global view of what's happening upstairs compared to what's happening downstairs. So please face me. And now feet together, knees locked. And I'm just going to have you bend as far forward as you can. So we're looking for how well his spine curves as well as can he touch his toes. So go ahead and come on back up and step forward, please. Hands overhead and bend as far back as you can. So Tate's got a lot of range of motion here, but he's doing really well there. Now feet together, face the camera, please. And I'm going to have you twist as far as you can toward your right. Yep, perfect. And then the opposite side. Good. So we're just trying to see, does he have symmetry when he does that? We would also take him through some balance testing. And lastly, let's have your feet together. And I want you to squat as low as you can. Perfect. And put your hands next to your feet. Perfect. So that checks a whole list of things to make sure that those movements are symmetrical, pain-free, and mobile. So now we would do a little bit more specific testing to where I would check the ligaments of the knee. So let's say we're checking his right knee. I would check valgus force here, where we make sure that his joint is mobile in multiple positions. So same thing on both sides, making sure that the ligament is intact. Now I'll sit on his foot like this and check some of the ACL and PCL ligaments for stability there. I like to do a little bit of additional testing here where we're just making sure that everything is stable and non-painful, so checking kneecap. And then I would just do a palpation of the quads, tibialis anterior, gastroc, the calf muscles in here, as well as the hamstring. Also looking for Baker's cyst and a few other things in the knee there. So that's the majority of our orthopedic testing and range of motion. Depending on what we find from that, we will do some more specific testing on what we see, so that what we call a breakout or additional more specific orthopedic testing if he's having joint line tenderness or an ankle or a hip or back issue that might also be contributing to the knee. Once we take you through all of these tests, we can then create a diagnosis that is specific to your condition, so that with that diagnosis we're able to create a treatment plan. Once we have a thorough assessment, then we create the diagnosis, then a customized treatment plan based on your diagnosis. So that treatment plan will consist of in-office treatments, which are some of our advanced massage therapy techniques like active release technique or fascial distortion model or trigger point. Sometimes dry needling if you like needles, and those have been effective for a lot of our patients. as well as joint manipulation. So we'll adjust extremity joints as well as your spine to make sure everything is moving as well as they can, so there's less compensation with your movements. So with all that, we will, that's what we do in the office. We will then give you homework so you can stretch what's tight and strengthen what's weak at home, so you're not completely reliant upon us. So that's the kind of broad range of things we would do for you to help you get better as fast as possible and get feeling better as soon as possible.